we basically put their pills or had them place their pills in a special bottle where the top contains a microchip. So every time they open the bottle cap records when the bottle was open, and periodically we can download that information. And what we found that as a group, the kids all opened their medicine bottles approximately half as often as we had prescribed. We have no way of knowing whether they took the right amount of medicine, 1 pill or 100 pills, but they didn't open up their bottles half the time. What was more of concern to us is that approximately a third of the children took less than a third of the medicines by this measurement. So there are about a quarter to a third of our kids who open up that bottle cap 80% of the time, and we consider them to be adherent, which means that 2/3 are taking less medicine, opening it less than time. And we just don't know what the biological significance of it is, but we don't think it can be very good. The younger adolescents, those between 11 and 13, seem to open their track caps about 60% of the time. As soon as they went into the 14 to 17 age range, that whole percentage dropped in half. So the older adolescents were taking their medicines about half as often as the younger adolescents. And what was somewhat disconcerting to us was that the children in the 8 to 11-year-old range, where the parents presumably control the medication, they only did slightly better. And our preliminary data suggests that their adherence was only about 2/3 of the time. I think one of the immediate concerns is that we're making clinical decisions, treatment decisions, based on inaccurate impressions of how the kids are doing on their medicines. If a child hasn't been taking the medicine for much of the preceding days, weeks, or months, and we come in thinking they have, we're more apt to either change the medicine or increase the dose. And this certainly reinforces some really bad habits. We may be giving inappropriate doses, we may be changing medicines inappropriately, and there's no easy way to make this determination clinically.